Hello, and welcome everyone to a Talk to Tony Wilson. In March and April of this year, New York called for volunteer workers to help with the coronavirus pandemic. My guest, Ashley Phillips of New York, is one of those courageous workers who volunteered her time each night when she got off of her day job. Thank you, Ashley, for joining me today to share your view of this coronavirus pandemic. How are you doing today?
I'm good, Tony. Thank you for having me. I'm really excited about this, and I'm glad that you put this together.
Thank you so much. Okay, can we just start with you just telling us something about your day job? Tell us some of your responsibilities.
Sure. So I am a coordinator of advocacy and outreach at GMHC. GMHC is a nonprofit organization. It is an aid service organization. Our mission is to end the epidemic and uplift all the lives that the AIDS epidemic and HIV has affected. I wear multiple hats in the agency, especially during the times of COVID. On one hand, I'm working in our mental health and substance use program. On the other hand, I'm helping out delivering meals to clients because our pantry program was shut down, and we decided to deliver the food directly to the clients.
Wow.
And the list can go on and on. But I have been there for going to be 5 years, and I'm a proud staff member. I love the agency.
Wonderful. Okay. Well, when you had heard that New York was crying out for some volunteer workers, what made you go and volunteer? What was that defining factor for you to make you say, well, I need to be there?
The deciding factor was when Governor Cuomo, ironically, had said that we are New York tough, and that we're New York strong, and that we all have to be there for each other. At that point, I said, I have some time in the evening that I can spare, and out to a colleague of mine that works for the Health and Hospitals Corporation, for the hospital, the city hospital system. And I signed up through there's a reserve website that we have for volunteers. And so I was connected to the HR personnel manager at Lincoln Hospital. And from there, the rest is history.
Okay. So was it like an application process, like you were going to a regular job? Did they ask questions?
Exactly. You put in all your, like if you have any credentials, your experience, what you're looking to volunteer and do. And for me, it was non-medical because I'm not a doctor, medical doctor. So clearly, but there was, medical doctors were not all that was needed. And from there, it was going in, filling out the paperwork. And I started the same day I went in. I remember that day, it was raining and I was drenched, and it was like, you're ready to go. And I'm like, okay.
All right.
Yeah, and I ended up signing up for the morgue.
Okay. Was that a volunteering for the morgue, or did they ask you to work in the morgue?
First, it started off as volunteering, and then it turned into a position because there's a lot of work that needed to be done. And I will say that my first day was chaos. Bodies coming in one door, funeral directors coming into another door, phone ringing. It was absolute chaos.
Had you worked in the morgue before? Because I know for me, like I say, I've been a nurse for many years, but my work has been at the bedside or managing those that do work at the bedside. So I know if I had gotten asked or even suggested to go work in the morgue, I probably
Well, ironically, in my mind, I was like, I'm going to do a few hours a week, nothing. It's like any other program. My specialty is program management. So you just give me, if we figure out what the program is, we will figure it out. Going in there, my whole goal was to organize the chaos. I can't work without structure. So when I got there with all the chaos that was going on, I was like, okay, we need some organization here. But I was nothing prepares you. Not even the horror movies that you see for what I saw there. It was
Can you
Yeah.
share some of that, what you saw?
So it was when I first got there again, we had trailers with bodies loaded on shelves. People coming in 5, 6, 7 at a time, 10 a shift. These were people's grandmothers, grandfathers, mothers, fathers
Mm-hmm.
that, they couldn't view them because the policy, they restricted viewing because of everything that was going on. So they put on this trailer and that's it. So I pretty much set up the inventory system, which is much similar to what you would find in maybe a retail stockroom, so that if you're looking for a specific person, then you know exactly where that person is.
Okay.
Because before it was if a funeral director came in and asked, you went looking for the person every time,
Wow.
and that was very time consuming.
Wow.
The 2 staff members that had been there for over 15, 20 years,
Mm-hmm.
they're used to maybe 1 or 2 bodies a night.
Wow.
Now you've pushed it up. You've raised it to 30 a day. I mean, it was a lot, and it was frustrating for them to see that many people dying.
Mm-hmm.
Not many people lasted in the morgue, work-wise, staff-wise. I mean, for as far as temp workers coming in, but the work needed to get done. There were doctors taking care of the living, but who was there to take care of the deceased?
Correct.
So I had to put all that behind me and just roll up my sleeves and get the things done. Like we have to do what we have to do. People, and that was speaking on that, at the same time fighting off people that said it was fake.
Right.
Fighting off people that said it was a government conspiracy and it was not real. And all they need to do is spend 1 hour in our morgue or the ER, and they would have gotten their answers. I had met doctors from other states that dropped everything just to come to New York to help us.
Wow.
Blew my mind. I was amazed. Colorado, or Arizona, Nebraska. And they were like, we just dropped everything and came. Y'all needed help, and we're here.
That's fantastic.
And then that we as a nation, even though we're New York tough, we had to come together to get through this.
Right. What were some of the hardest things that you had to watch? I know there's a lot of deaths that were there, but what is some of the hardest things that you had to do, had to watch, or had
some
to
of it? Well, you have to open up the body bag to identify the toe tag and the wristband to make sure that the spelling is correct, that it's the correct deceased person, that the death certificate matches, the paperwork matches. And every time you open it up, that's somebody's grandmother. It's somebody's grandfather.
Wow.
I had lost my uncle in that. I had lost colleagues, coworkers, friends to the virus. And every time it was like I was opening up one of their bags. So I knew that the family couldn't be there, but at least we were there to help their deceased get through that time.
Did you have to be responsible or take care of some of family members of yours?
Of the what?
Did you have to be responsible for maybe some of the family members that you knew?
We had to.
Yeah.
Well, there was a colleague that came through, and I recognized the name, and I was like surprised.
Wow.
It's like one of our own fallen, and that she worked in the field in my regular job, like she worked for nonprofit, and no work that she did, seeing that, that hurt you.
That is so sad.
The worst thing I think we saw was a 7-year-old who, through obesity, I assume he had COVID, and then whatever complications that arisen from having COVID, that pretty much ended his life.
Wow.
And that hurt. It hurt a lot to see people left and right. I had heard, because you can hear the announcements when somebody codes, when somebody goes into cardiac arrest. 5 people in 20 minutes. And I knew that they weren't coming back once they coded. So 5 minutes after the first call, in about 20 minutes, we were going to see that person.
Mm.
And it was 5 people back to back. And I was just, some of us would sit down after a day and just take a deep breath and ask if it's going to end.
Wow. Wow. Well, how are you still working both jobs now?
I am. I'm
Okay.
still. I think I should be done. We're there till September,
Okay.
just in case if there's a spike in anything, so
Uh-huh.
we're to handle it.
Okay.
But yeah, I'm still doing both.
Wow. Well, how do you keep yourself motivated? It's
Hmm.
like seeing death day in, day out. How do you just keep yourself motivated? How do you just keep going?
That's interesting. My own therapist, who probably tried to fire me several times after telling him I'm going to work in the morgue, he's like, "No, don't do it." I'm like I have to. You know, I have had a colorful life. You know, I am a person of trans experience,
Mm-hmm.
and I know what it's like to struggle. I know what it's like to have nobody there. Everything that I have worked for, I've earned it.
Mm-hmm.
And so every day I get up to strive to be a better person. So this is part of that.
Okay.
Now, don't think that there's no self-care in this. I do have hobbies on the side.
Okay.
When I get a day off, I actually like to drive somewhere that's not New York City
Mm-hmm.
and look at views. Or I work on leather pocketbooks and handbags. That is my hobby at home.
Just you're kind of get away from it all kind of thing.
Yes, because my mind is focused on measurements, colors. Does this go with that? So I'm totally immersed in what the project that I'm working on.
Okay, great. Okay. Well, if this video could circulate throughout the United States, what message would you want to tell us all? What would you want us to know about the coronavirus?
You know, I don't know what more that I can say that hasn't been said already.
Mm-hmm.
But for those that don't believe that it's real, it's real.
Mm-hmm.
Wearing a mask does save lives. People don't know how they've gotten the virus.
Mm-hmm.
I'm not going to say that somebody's committing a murder by not wearing a mask, but if you think of it that way, maybe you wear a mask.
Right.
If you think by saving somebody's aunt and uncle and grandfather from going through the grief of losing that person and that person catching it and what they have to suffer until they actually succumb to it,
Mm-hmm.
all it takes is wearing a mask until we figured out how to get rid of this virus. This is the only way. What harm does it take to wear a mask or stay 6 feet from somebody who isn't wearing a mask?
Mm-hmm.
Or stay at home. Only go when you have to. If you've seen some of the family members that cried when they heard about, you know, their loved ones dying,
Mm-hmm.
who knows how they got it? Because somebody else didn't wear a mask.
Mm-hmm.
Or we didn't know enough about it. But now we do. We know enough. Wear a mask. Wash your hands.
Yeah. Maybe distance.
Distance yourself. What harm right now? You're not losing anything by taking time and paying attention, being observant. I'm going to stay 6 feet away from this person. They don't have a mask. I shouldn't have to assault that person because they're not wearing a mask.
Right.
But I went to a park recently with my brother.
Mm-hmm.
When we got to the entrance of the park, it was filled with hundreds of people. I said, "Oh, not me. I am not going in because I've seen enough of it.
Yeah.
Until we've eradicated it, then I'm going to stay my distance. Nothing wrong with that.
Right.
Nothing is more important than the life saved by wearing a mask or staying a distance."
Wow, Ashley, your story just gives me chills. We have to be vigilant. People, pay attention. Ashley just gave us her story. Please protect yourself and protect others. And also, what I want you all to do, I haven't asked y'all this in my videos before, but please hit the like and the share button below. let's get Ashley's story across the United States. And also while you're there, put in a comment just to show what state you're listening from. Ashley, I want to thank you so much for coming on. Like I said, you just give us a different perspective. Our thoughts, of course, mainly have been with the people that are currently struggling with the coronavirus, but there is another side to that also. Everybody is not recovering. So, please listen to what Ashley is telling us. Ashley, you have anything else you'd like to add?
I think you said it all, Tony. I think you've done
Okay. I believe you have too.
I think that comes with your healthcare background, the need to have to get this out there, because we all know this is not real. Never worked in a hospital until now, and when I saw it firsthand, these doctors, I commend them. The ones that were in there saving lives. I had a friend in 1 hour pronounced 10 people dead in an hour.
Wow.
He's stressed because these are people's family. So Tony, I commend you for this. This is needed. I don't think enough of this is done. I think everybody should share it, like it. Yeah. There's always going to be a difference of opinion, but I'm welcome. I'm open to discussion.
Right. Okay. Well, Ashley, again, thank you for all your courageous hard work. And again, like I say, please make sure you're taking care of yourself also.
Thank you, Tony. I am.
All right. Well, this concludes another Talk to Tony Wilson. And to all I will say, you have a great day.